We know 2017 and 2019 were bad years for the flu. We know that 2020 and 2021, we almost had no flu in Australia. So that was in part because of the restrictions that were in place, but also because of the travel restrictions that were in place. We just didn't get flu introduced to Australia. This year, we definitely have the flu. It's definitely started to be reported in Australia. We don't yet know how bad the year is going to be, but we certainly know it's not going to be a good year for the flu. It's not going to be a year that we don't see too much flu and we don't see too many deaths from the flu, and it's certainly at least going to be an average year. The flu has an impact both on individuals, so if you get the flu, that can have an impact, and then it can have an impact on communities. And that's because if you have a bad flu year, you have a lot more people going into hospital, so how bad a flu year is can put a real strain on the healthcare system. So this year, we have an outbreak of COVID at the same time as we have an outbreak of the flu. Either of those things can put a strain on the healthcare system and are putting strains on the healthcare system, but you combine the two and you kind of get into a crisis situation with respect to our healthcare system. So there's been a lot of concern about flurona, so the combination of the flu and COVID, and that's a real thing. So in earlier times, in other countries where there was flu and COVID at the same time during peaks of the flu, they did find that some people unfortunately had both. And what we know from research done elsewhere is that you're twice as likely to have serious problems as if you only had one. So as we know, the main COVID strain that's out in the community is Omicron. People were talking about Omicron being mild. Omicron's not really mild. Omicron's only mild because so many of us have been vaccinated. And in South Africa, where they first identified it, so many people had had COVID before. Omicron has a family. So there are a family of different types of Omicron, each having kind of somewhat different characteristics, particularly in how easily they transmit. And so they're kind of in the environment competing with each other in terms of which one is going to be most dominant. Why is that important? It's important because there's likely going to be another peak in another wave of Omicron happening. So we first had this huge wave over Christmas and early in January with BA1. So then April, May, we saw this wave that not as high, but significant, sent a lot of people to hospital. A lot of people died during the second wave that was related to BA2. So now that's settling down. So now what we're going to see is another wave related to BA4 and 5. What we don't know is how high that peak's going to be, but because a lot of people's immunity has waned from having had it once, because we're getting back to life, basically ignoring COVID exists, everyone's getting back to their usual routine, not wearing masks, not socially distancing, etc. There's going to be another peak that relates to BA4 and 5. The question is how high. That I'm not sure of, but it's going to be another peak that has an effect on our healthcare systems right at the time that we have the flu.